The social issue that I will address during this presentation is mental health issues in the rural community. What is rural? According to the U.S. Census Bureau, rural is defined as any population, housing, or territory not in an urban area. A rural area has open land with very few homes. The population in rural areas are very low in that there are fewer than 2,500 people. The household incomes in the rural community is also very low. The median income is $42,993. Issues with mental health in the rural community. Some of those issues include one of the biggest issues regarding the mental health needs of citizens in the rural community is access to services. Nearly 3/4 of rural communities lack a psychiatrist and 95% lack a child psychiatrist. Suicide rates among the male residents is higher than male residents in urban communities. Also, rural residents are less likely to identify that there is a mental issue or to seek treatment. Additional issues include utilization of services. The use of mental health is lower in the rural community than it is in urban communities. There are several studies that suggest that race, age, and socioeconomic status is a contributing factor in mental health conditions of rural residents. There is also a cultural difference in the way African Americans and Caucasian individuals address mental health issues. Accessing mental health services are especially difficult for the elderly population in rural communities. It is estimated that 15 to 25% of non-institutional elderly suffer from mental health disorders. Additional items that affect accessibility include children with mild mental health issues most likely receive services from school counselors, child protective service workers, and family physicians. Also, teens in rural communities receive mental health by visiting emergency room departments, health departments, and school-based clinics. Theoretical framework associated with mental health in rural communities include, as mentioned throughout this presentation, many rural residents address mental health issues by using spirituality as a coping skill. This coincides with the transpersonal theory, as the intervention involved with this theory requires understanding of assessment and client's faith and development, understanding and supporting supporting clients' spiritual and religious beliefs, practices, as well as support systems. I also believe that the systems theory is also applicable to rural health and mental health in a rural community, in that systems theory is also applicable in that by strengthening one part of the system, such as mental health, or subsystem to impact the whole system, physical and emotional health, networking, and referrals to facilitate change, and the assessment of family development and lifestyle transitions, and the use of family and parent coaching. Current policies and programs addressing mental health in rural community include mental health centers in the community is vital to addressing mental health concerns for residents of rural communities. Telehealth services to include telepsychiatry, telemental health, and telemedicine in rural communities have improved access to mental health needs of the population. The Medicaid Management Behavioral healthcare organizations have increased utilization in these communities according to case studies completed in Maine and Montana. Also, through the passage of the Affordable Care Act in 2011, this act mandates that healthcare providers to treat mental health as an essential health benefit. Some advantages and disadvantages of working rural mental health in the rural community. The advantages include individuals within the rural community use faith as a coping skill. Most depend on having a relationship with clergy, ministers, and etc. Social workers within the rural community are familiar with other residents and rapport can easily be established. Also, there is a strong support network among rural populations which is used to encourage individuals to seek treatment. Some of the disadvantages include children with serious mental health needs are most often unmet because their access to a psychiatrist is minimal, meaning that there is either one or no provider in the community. Due to the size of rural communities, the ability to have anonymity is difficult. Everyone knows everyone. That can also be a strength as well. Another disadvantage is social workers in the rural community have dual roles. They have professional as well as personal relationships with their clients. This one can also be a strength as well. Stigma associated with mental health treatment is more pronounced in rural communities. Additional disadvantages include long-term wait times for the scheduling of mental health appointments, communication issues between mental health specialists and primary care physicians is a major disadvantage. And then another disadvantage includes minimum mental health providers available to residents. Recommendations for improvement include there needs to be better cohesiveness between medical and mental health providers for there to be a continuity of services to the community as well as positive outcomes. Primary care doctors should consider hiring a mental health professional in order for access to mental health services to be more accessible. Training for primary care physicians to diagnose as well as treat patients with mental health disorders. An increased availability of non-doctoral level psychologists and social workers supported by a licensed professional could enhance staffing at community health centers. Provision of federal and state funds for training of mental health professionals. And then the last recommendation I found during my research includes there needs to be a widespread consensus among policymakers and health providers that care at the interface of primary and secondary services must be improved if health inequalities are to be reduced. Here is my list of references that I used during this presentation, and I hope that you all find this presentation to be beneficial, and if there are any questions, please let me know. Thank you for your time.